On behalf of all of the co-organizers, who you'll hear from in just a moment, I would like to acknowledge that we are on the traditional territories of many nations, including the Mississaugas of the New Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples, and that Toronto is now home to many diverse First Nations, Inuit, Métis, and other Indigenous peoples from Turtle Island. So to get us started, I would like to invite to the podium Ms. Kathy Bernard. And team. And crew.
I brought some British Columbia sunshine. What is that white stuff out there? Good morning. On behalf of the organizers of the newly branded Patients Redefining Healthcare Summit, Save Your Skin, the Schizophrenia Society of Ontario, and new partner, the Canadian Psoriasis Network, I welcome you all to this year's summit. This is the 4th annual summit, and I know that some of you have attended all. Others are returning attendees from previous years, and some are newcomers to this group and event. As a brief history about the event, the purpose of the first summit was to educate patient groups, patient representatives, as well as individual patients about the structures underpinning our healthcare system, both federally and provincially, and in the private sphere. It was a time when change was in the air, particularly relating to drug pricing policies in Canada, and few really understood that these policies changed the potential impact on patients' health. We were a small group that first year with 3 patient attendees, 28 observers. The main outcome from the summit was the creation of working groups across disease groups and provincial borders to work on health policy and treatment access issues of common concern. The second year, we expanded the agenda to include the concept of value-based healthcare, as specifically defined in the book Redefining Healthcare, written by 2 doctors from the U.S., Michael Porter and Elizabeth Teesberg. The patient groups in attendance, of which there were 38, heard high-level discussions about this concept and how it might indeed be a solution to the access and sustainability issues plaguing Canada's public and private systems. There was broad endorsement for this concept for Canada. Working groups continued after the summit.
Last year, the 45 patient group attendees did a 2-day deep dive into the components necessary for value-based healthcare to be implemented, to be successful, and to be endorsed by all necessary healthcare stakeholders. We heard a call for a proof of concept project led by patients and saw the interest in validating the importance of patient-reported outcomes as a foundational requirement to achieving and measuring value-based healthcare. And here we are today with 150 registrants, although I guess the snow is making a few a little bit late, split equally between patients and patient group observers, to talk about what's happened in Canada regarding value-based healthcare and to look at the Canadian healthcare landscape. We've had some interesting elections across the country over the last little while, and some very exciting things are happening in both good ways and ways that present new challenges. We certainly have an interesting journey ahead.
Thank you, Kaylin. As with all events, there are so many people to thank. I want to start by thanking our funders, without whom we could not hold this gathering. Many of them have been with us from the first event and have trusted us to pull this agenda together year after year. So thank you to our supporters in alphabetical order: Amgen, AstraZeneca, Bristol Myers Squibb, Janssen, GSK, Leo, Merck, Novartis, and Pfizer, as well as Innovative Medicines Canada for supporting our working groups. Thank you to each of you for joining us despite the cold that Kathy brought in, and for your belief in this project and your unconditional support for an entirely patient and caregiver conceived and developed, led and run project. Thank you to 360 Public Affairs, and especially Jerry Jeffcott and Alex Kyriakos for facilitating our observer groups, to the steering committee for the event, that's Erin Boudreau and Kaylin Boyd of SSO, Louise Binder and Natalie Richardson of Save Your Skin Foundation, myself of the Canadian Psoriasis Network, and Leah Stevenson, of course. We also want to thank the working groups that developed this afternoon's value-based healthcare programming. We're very grateful to have people come in from across different provinces to share their to share their presentations with us, including Shanil Patak, Louise Binder, Cheryl Ann Simino, Christina Sitt, and John Sodden, supported by Leah Stevenson. Thank you to all of the provincial working group members who planned tomorrow's panels. Their names are all in your program, so please have a look. And thank you to our retiring partner, Canadian Cancer Survivor Network, for all of your hard work and continued support for this event. Thank you to our small group facilitators, Ron Rosinez, John Sodden, Cheryl Ann Simino. And thank you to Joanne Harabas for taking notes again this year. We'd like to make a special mention of our venue, the Japanese Canadian Cultural Centre, who always make us feel at home, and the amazing caterers, Oak Park Deli. We hope you've had a chance to enjoy some fruit. Thank you to Red Tree Productions for providing the AV support again. And thanks to Natalie Richardson for managing our Twitter and social media. We also want to recognize the registration table support that we get year after year, and this year, Kaylin and Chantel, thank you for taking the time. And an extra shout out to Chantel for all of your logistics and coordination support leading up to the summit. So for making this happen, essentially. And thank you once again to everyone here today for attending and making it out today. So with no further ado, I'll turn our event over to our summit facilitator, Leah Stevenson, to take us through the agenda for the next 2 days and to get us started on this 2-day patient summit.
So welcome everybody once again to our 4th annual summit, newly rebranded A Dose of Reality, Patients Redefining the Future of Healthcare in Canada. Thanks, Antonella, for being amazing and fixing everything. Before we get started, we want to make a special acknowledgement. I don't know if they've arrived yet, but of 2 people from patient groups. There are a couple who, they're not here yet? Okay. Well, we might acknowledge them one more time. They have been attending the summit since the very beginning. They have consistently attended every year, and they are, what's that? They were the first people to sign up the first year. So that is enthusiasm. And that's Michael and Margaret Eigenram. So I do hope to actually be able to pronounce their name correctly when we re-acknowledge them when they're here. So this year's summit aims to update you on what's happening in healthcare across the country. As mentioned, there's been a lot of change through elections, both federally and provincially. And so we really want to get an update on what's happening across the country. That's hopefully improving value for patients and caregivers. And this afternoon, we're going to be focusing more on current and emerging value-based healthcare initiatives that are taking place here in Canada. And tomorrow, as mentioned, patient representatives from across the country have, and from each province, have prepared and will be sharing with you the current health policy issues, barriers, and opportunities that they see impacting patients and caregivers in their parts of the country. So our objectives for the 2 days are to enhance your knowledge about the health systems in Canada and the impacts that the systems have on patients and caregivers, to create more synergies and recognition of common issues across patient groups and with other healthcare stakeholders, engage policymakers and other stakeholders to foster collaboration between the different stakeholder groups, including patients, caregivers, researchers, government, and non-governmental agencies and other partners, and fundamentally to support the conversation about how patients can better influence the design, all aspects, including the design of the healthcare systems that they deserve in Canada. So I'm just going to do a quick review of the agenda. It's pretty action-packed, as you noticed, over the 2 days. Before I do that, I also want to just encourage, just in case you haven't already done so, people that identify as patients or caregivers or representing patient or caregiver groups, we encourage you to be towards the front of the room. And those of you who are part of other sectors, what we our friendly term is observer groups. So any other sector outside of patients and caregivers, we encourage you to take up more the middle and back portions of the room, please. So as part of our action-packed 2 days together, this morning we're pleased to start with a series of presentations, and these are from healthcare bodies across Canada. Our first presenter is going to provide a brief overview of Canada's health systems. So just a quick 101 to refresh ourselves and level set who has responsibility for what, including at the national and the provincial and territorial levels. As you know, we have a bit of a complex system here in Canada, so we're just going to level set on that briefly. Then we're going to have different presenters provide brief overviews of what's happening with different bodies that play key roles in Canada's health systems. We're extremely pleased to have a presenter this morning who is going to be sharing with us information on Indigenous health in Canada, as well as a presenter providing an overview of the social determinants of health. And finally, this morning we'll have Jennifer Clausen, who's from the Boston Consulting Group, join us via video conference, and she's going to be providing an overview of what value-based healthcare is. Again, just a quick level set of what is this value-based healthcare thing, and so we can level set on that. And why is it, how does it matter? Why does it matter to patients and to caregivers? Because, you know, we like to do a lot, and there's so much going on. This morning, we're also going to have some brief remarks from Ontario's parliamentary assistant to the Minister of Health, Robin Martin. And then this afternoon, we're going to do some spotlighting. We're going to go a little bit deeper, and we're going to spotlight 3 different value-based healthcare initiatives that are taking place and forming in Canada currently to get a better sense of what's happening in Canada right now as it relates to value-based healthcare. So one presenter from Ontario is going to focus on initiatives that support value-based healthcare in the context of integrated primary healthcare. Another is going to talk about national convening to support value-based healthcare, as well as sharing an exciting proof of concept partnership that's being developed with the provincial patient group. So now you can start to see how last year people said, yeah, this value-based healthcare thing makes sense. Let's go deeper on it. Let's understand it better. Here's what we think are important principles. And you know what? We really need to figure out this PROM stuff, and we really need to develop some proof of concept that's patient-driven. So we've been listening, and we're bringing it back to you to share this afternoon. And our last presenter, as also coming out of last year's summit, this afternoon is going to be providing an overview of patient-reported outcome measures, or PROMs. No, it's not the fancy dress and like the date and the tears PROMs. It's the PROMs that, you know, data people love, and that hopefully all of us will learn to love as well. So what are PROMs? Why are they important in value-based healthcare? How are they developed? And, you know, what are some best practices in patient co-design in the development of PROMs? And then we're going to get into breakout groups to explore these PROMs more closely, and I'll explain that more in a moment. And that's just day one. Whew, okay. So now that we're through day one, tomorrow morning we're going to have patient panelists from different provinces across the country present on what's happening in their jurisdictions from their perspectives. And fundamentally, they're going to be telling us what they see as the greatest health policy issues impacting patients and patients and caregivers in their provinces, the barriers that this represents, and the recommendations to move the needle forward. And once we're complete those presentations tomorrow morning, we're going to say we're going to encourage everyone to stay for the lunch and learn, which I'll share more about in a second. But we're also going to say farewell to our observer participants because the afternoon is going to be patients and caregivers getting into small groups, digesting the information that you've been hearing and reflecting on, and starting to determine together what, if anything, we want as patient groups and caregivers to work on together. If there's any opportunities for change that we see it would make sense for people to gather together and in some way support each other in that work. So we'll talk more about that process and everything tomorrow. So as I mentioned, I would like to flag for everyone that our lunch hours on both days do have lunch and learns. And they're optional, but you're strongly encouraged to join. Today, you're very welcome to join Lunch and Learn with the Canadian Partnership Against Cancer. And this is going to take place up on the second floor in room 2A. There's some directional signs pointing your way, but you can either take the stairs or the elevator, go right upstairs, turn left, it's right there. It's room 2A. Tomorrow, you're very warmly welcome to join a Lunch and Learn on Indigenous health in Canada, and that will be led by Sharon Clark, the program lead in Indigenous health at CIHI. Again, it's in the same room, 2A, on the second floor. And just a few basic ground rules, really. There's just 3 of them. And it's because there is such vast, diverse, and rich experiences in the room that we really want to make sure that we maximize and optimize our time together and achieve as much as possible the aims of the summit. So the ground rules are that we do our best to respect each other's opinions and to strive where different people are, to understand where different people are coming from. So really to work to share the space, give voice to other people, have it, enable an environment where everyone has a chance to contribute their voice and their perspective. So if one person at the table is doing all the talking, for example, maybe try to encourage others to voice their opinions as well. Secondly, when you are making a statement, particularly when it's in a public forum or in your small groups, it can be helpful to identify whether you're doing so as an individual or as a representative from an organization. So fundamentally, are you speaking from a personal perspective or from an organizational perspective? It's just sometimes can be helpful, and sometimes you might be speaking from both, so just clarify where it's personal and where it's an organizational position. It can be helpful for people to understand that. And then thirdly, while stories of our personal journeys are absolutely fundamental and fundamentally important to the work we do, we have very limited time together. So we ask that you try not to go into the details of a personal story, but rather focus on the broader policy impacts of what that story represents. So how does your personal story or that of people living with a similar disease or disability or health condition, what does that teach us about the broader systemic and policy issues that need to be addressed? And then finally, if anything comes up for you throughout the 2 days, any questions or comments that are really specific to you or to your disease or disability group and you don't feel like there's a place for you to share it, feel free to write it down and give it to me or to any of the organizers who just introduced the event, and we will do our best, include your name and contact information, we'll do our best to connect you with someone who can help answer whatever that question or query is. So just a little bit on process. This morning, as I mentioned, you're going to be hearing a series of presentations from different national bodies, including Health Canada, the Canadian Agency for Drugs and Technology in Health, etc. And so what you're going to find in your packages is you all should have received these templates with a cute guy going extra, extra, newspaper headlines in your packages. And so what we've done with these is we're encouraging you, as you listen to each presenter, to draw a headline, as if you were a journalist covering the story. Sort of what's the headline coming out of that presenter's remarks for you. There are pens on the table. Some of you might have some markers and stuff like that too. Feel free to get creative with it. And we'll have people circulating over the breaks and lunch and picking up any headlines that you do. And we're going to put them on the wall. So Health Canada will be up there, PMPRB. Don't put your names on these things, just the headline. And that way, throughout the day, we encourage you just to take a look and see what people are writing. Let's take a look at each other's sort of headlines, how people heard the different presentations from this morning. So feel free to be creative. If you're the kind of person a little bit more right-brained and you want to draw a picture, have fun. Go for it. And we can't wait to see what you come up with. So in the afternoon, after we're done with all the presentations and the final presentation being on patient-reported outcome measures, or PROMs, just think of the pretty dresses and the tuxedos, we're going to then form breakout groups at that point, because we want to start to make PROMs a little bit more concrete and explore them a bit further. So at that point, we're going to be asking everyone to organize themselves into 4, if you're in patient and caregiver groups, we're going to be asking you to organize yourselves into 4 smaller groups that will be facilitated. And we're basing it roughly on health condition, the health condition that you're living with or that your organization represents. I'll talk about the observer group separately in just a second. And what we're going to use is standard sets of outcomes that come from ICHOM, the International Health Outcomes Measurement Consortium. And we want to get your feedback on these outcomes. So these are standard sets that we've organized them into 4 very rough groupings, guys. Like, this is really rough. It's chronic conditions. And so in chronic, it's things like cardiovascular, diabetes, arthritis, eye conditions. And there's a couple of acute conditions that are in there, too, that sometimes follow chronic conditions like heart failure and stroke. The second one is different types of cancers, and ICHOM currently has 5 different cancers with standard sets in them. The third one is mental health, and currently ICHOM only has adult depression and anxiety. And then the final group, where maybe none of these apply to you, or maybe it's just a particular population that's of interest to you, the fourth group will focus on a population. ICHOM's language is older people, so seniors, elders. And patient groups will stay in this room. The different facilitators will have signs that say chronic or cancers or mental health or older people, so you can help sort yourselves that way. And then they'll have hard copies of these standard sets for you to take a look at. They're also all online, so if you have a tablet or an iPad or a phone, you can look at them yourself right on your phone. And they're going to lead you, after you've reviewed them, through a series of questions to get your feedback on these. The observer groups are going to go upstairs, and they're going to be with 360 Public Affairs, to room 2A. And because there's only 2 facilitators, so it's harder to do all the small groups, I think they're going to focus on the older people population group and work with you guys as a whole. So then we're all going to come back together and do a quick report back. So let me just finish up with a few logistical items. Wi-Fi, it's an open network, and it's called JCCC Open. Washrooms are here on the main floor. It's to the left of our room. You just walk past the gift shop, and you'll see them on the left-hand side. We are videotaping the event, and as with past years, we will post the whole event online for people who couldn't make it. So if you do not want to be on camera, then we encourage you just to sit on this side of the room that's on facing the stage. It's the right side of the room. From my perspective, it's the left side of the room on the other side of this column. So there's the camera there. So if you don't want to be on camera, sit on this side of the column, closer to that wall. Now, without further ado, I'm very pleased to get us started by inviting to the podium today someone I'm sure you all know very well and love very dearly. If you don't, you will know her by the end of our 2 days together, I guarantee it. She's going to set the stage for us with a short overview of Canada's health systems. Who are the key players? What are their roles? Let's warmly welcome to the stage my inspirational friend and colleague, Louise Binder.
Well, thank you all for coming out in this bad weather and caring about the future of healthcare in Canada. I noted that Leah said by the end of the 2 days you'll get to know me, but she made no suggestion that you'll get to love me, and that's probably true. So I have 15 minutes to do the impossible, which is to give you an overview of our health systems in Canada. And the reason I'm doing this is even though each of the presenters will provide an explanation of what their particular government agency does, I want you to think about the fact that we're having how many presenters? 8, 10, 12? I don't know. Some Byzantine number of presenters. So, it sounds good when you hear them one after another, but think about the fact that all of the people who are presenting here, we've got to get our drugs through every single one of these agencies before they even have the slightest hope of getting into anybody's hands. So I guess you've already figured out that I think we've got way too much, takes way too long, and we really need to redefine healthcare in this country. So maybe now we can all go home. That's it there. But I will say a little bit just to give you the umbrella of this thing and write some headlines. Please. First of all, before I go through this quickly, a couple of reminders. People think we have a universal healthcare system in Canada. I hope you've had enough coffee to accept the news that we have no such thing. We have never had any such thing, and unless somebody wants to open up the Canada Health Act, which I highly doubt, we will never have any such thing. So, the Canada Health Act, that's a federal piece of legislation. It applies all across the country in every province and territory, and federally as well. It says the federal government will make sure that there is money for doctors and hospitals, the only two on the list. We all know that even within that, we don't get to see all the doctors we want whenever we want, and we don't get everything we want in the hospitals either. So even within the buckets that the federal government has promised us to have, we don't get everything in there. The only reason we get any drugs at all is because those drugs are being provided in the hospital, and do remember, hospitals make their own decisions about the lists of drugs that they're going to provide. So then for the rest of us who are not at the doctor's office or in the hospital, there is no drug coverage whatsoever except what the provinces, each individually, and the territories decide to provide. And that is why we have what is so often referred to as the great patchwork quilt of drug coverage across this country, because every province has its own politics, its own bureaucracies, its own economic engines, its own priorities, and I could go on and on. I could do 15 hours, not 15 minutes, just on that. So keep that in mind. We don't have any commitment to anything in terms of drugs except what the provinces want to do. Keep in mind also that the federal government has a very special legal relationship with our Indigenous communities, and I'm so thrilled that we're going to be having some conversations about that over these 2 days as well. But they do have a legal relationship that requires the federal government to provide health care to Indigenous populations on reserves. And I can assure you that I'm sure we're going to hear how lacking those are as well before these 2 days are over. Also a reminder that in addition to the public provinces providing reimbursements for some treatments, we also have a very large proportion of people, somewhere between 40 and 60 depending on whose numbers you want to use, who also have private insurance. That's very important in the conversation about pharmacare, because there's some conversation about getting rid of private insurance. The Elizabeth Warren model, if you've been watching the US system. And so we've got all of this soup before we can get anything into the hands of patients. So it's no wonder that patients really are not getting the access that they need. So in the other 5 minutes that I have, let me take you through the list here. So we start with drug development. Well, of course, somebody, as I always say to my colleagues in the pharmaceutical industry, and the researchers, just go and stir something up for us. Just go off and stir some things up for us, because we need some new things to get stirred up. So that's what they're doing. That's my theory about it. They're all there stirring little things in test tubes and in rats and mice and whatever it is that they're doing. Thank God they do, because without them, we would never get anywhere. But that takes a long time. There's a lot of stirring. My colleagues in the industry and researchers tell me it takes about 7 to 10 years before they can actually find a product that they think is good enough for some person to take. And then they have to get it to Health Canada, which is a federal body, and we'll get more detail about it in a minute, but it's a federal body that makes the decision whether drugs are safe, effective, and of good manufacturing practices, good enough to be sold in the Canadian marketplace. And once it gets through that process, then we have the question of, well, what are we going to allow people to charge for it? And that's where the Patent and Medicine Prices Review Board comes in, and Wayne is going to tell us about that organization and some changes that it's made in terms of how it makes that decision. Then, as that is taking place, you also then move to a recommendation body called the Canadian Agency for Drugs and Technologies in Health. And that is answering the question for the provinces, the territories, and the federal government that is in this body. Looking at this therapy, and also looking at it now in relation to other therapies, sequencing, is this therapy a good value for us to write a check from the public purse in our province, our territory, or federally? Okay. that's a whole other story. In the province of Quebec, we have INES, which does the same thing for Quebec with some different rules, and you'll hear about them, slightly different than the CADITH rules. And then if there is a recommendation that this drug does have value, it almost always will come with the condition that the price is too high and go and negotiate a lower price. So then it goes over to our colleagues at the Pan-Canadian Pharmaceutical Alliance to negotiate a price. And a couple of provinces will be the first to take the lead on that. But then the problem is that even after a price is negotiated, and even if all the provinces have been at the table, it then goes to each province to decide whether they're going to list it, even if they've agreed that the price is reasonable. So that's just a beginning of some of the issues to get things actually into people's hands. And of course, then you have the private insurers, and we're going to hear from them about how they make their decisions about what they're going to cover. We have that CAPCA, which gives advice from the oncology perspective. It's an association of oncology agencies across the country that gives some advice. And did I leave anybody else out? If I did, I'm sure we'll be hearing from them. So I don't know if you agree with me, and it doesn't matter, I'll still hold this opinion, that we got too much going on. And there have got to be ways that we can make this system faster, simpler, and just as efficient, and just as effective, and just as affordable, and just as sustainable without so many layers here. And just to end on another depressing note, as if we don't have enough layers, now with this new idea of pharmacare at the national level, there's a decision that we may need a new agency called a drug listing agency. I don't know what it's going to be called, a new drug agency that's now going to create another list of drugs that maybe we're going to get someday and maybe we're not. So not that I have any strong opinions about our system at all, but I hope that will help you put into context what each of our presenters is going to be telling you. And I hope I stayed within my 15 minutes. So I'm not going to answer questions because I couldn't, but let's hear our speakers, and let's start at the top with Health Canada.